We are also live on YouTube, ma'am. We can start now, ma'am.
Good evening, everyone. On this auspicious occasion of Basant Panchami as well as Valentine's Day, I welcome you all to today's webisode 3 of the webinar series Confusion, Clarity, and Consensus. Um, Today's topic is adult vaccination, and in most of our minds, vaccination means vaccination to children. But we all need to ponder on adult vaccination, a thing which even we doctors are neglecting day in and day out. So, we have none other than Dr. Rishikesh Pai, who will focus on this topic. And I request Dr. Anju Soni to kindly welcome Dr. Rishikesh Pai as well as our chairpersons for today. So, I hand over the further proceedings to Dr. Anju Soni.
Thank you, Dr. Shubha. A very, very good afternoon to all the esteemed guests, respected colleagues, and dear friends. On this significant day of 14th February, we have come together for the third episode of CCC C Wisdom Series, and I am both honored and humble to convene this virtual vital discussion on adult vaccination, a subject that warrants our undivided attention and immediate action. As your convener, the president of IMS 2425, I am delighted to introduce a panel of luminaries who will guide our understanding and enrich our practice in the field of OBGYN. I am acutely aware of the challenges we face in India regarding adult immunization. Despite having a robust vaccination program for children, it is stark reality that adults in our nation are left vastly unprotected against a myriad of preventable diseases. Today, gathering is not just another event on the calendar. It is a embodiment of our commitment to preventing the preventable. It is testament to our dedication to bridging the gap between global practices and our current state to ensure that every Indian adult is guaranteed granted the shield of immunity that vaccination provide. We are privileged to have with us Dr. Rishikesh Pai, our esteemed president of 2023, who doesn't require any introduction. He is a very popular president amongst all of us to deliver an oration that promises to enlighten us with his profound insights on the need of adult vaccination. His experiences, his expertise, coupled with the collective wisdom of our chairpersons and coordinators, set a stage for transformative session. It is upon us to carry the torch of this awareness to illuminate the path of for the countries, others who are yet in dark about the importance of adult vaccination. Our discussion today must transcend these walls, echo in the policies we advocate and practices we implement and the lives we touch. We are privileged to have with us uh, uh, Dr. Rishikesh Pai, a beacon of knowledge and a current president also of 2023, who will be delivering his uh, oration. And leading this session as chairpersons are Dr. Narendra Malhotra, President Foxy 208, whose visionary leadership continues to inspire us, and Padma Shri Dr. Usha Sharma, whose distinguished services as ex-DG Medical Education, UP, and many, many more feathers in our cap uh, will be instrumental in shaping the medical education and practices in our country. We are also joined by our esteemed coordinator, Dr. Pratik Tambe, who is rendered exceptional services as chairperson of Endocrinology Committee, Dr. Shubha Sethia, and Dr. Sweetie Soni, both senior consultants in OBGYN at Jaipur, whose contribution have been pivotal in advancing women healthcare. Each chairperson and coordinator coordinator brings a wealth of experience, expertise that is invaluable in our discussions today. Together, they form a cornerstone of this event, ensuring a session replete with clinical wisdom and practical insights. And I would also like to welcome Dr. Lakshmi Srikhande, immediate past chair of ICOG, who has been there always in all kinds of academic events. Uh, and guiding each and everyone. She has been known for her educational efforts in last 1 year. Everybody knows her. She doesn't require any introduction. And I would like to thank all the delegates who have joined today for this very, very important discussion. Over to you, Dr. Nisal and Usha ma'am, to introduce our speaker.
मैडम आप इंट्रोड्यूस करें ऋषिकेश को I'll introduce the topic.
Past president, immediate past president को करे.
I'm okay with it. Friends of everyone, Valentine's Day.
Yes. No, I don't think otherwise Rishikesh really needs any introduction. But as it is customary, we can always say that he is a very dynamic, hardworking, and a very good leader. And he has shown his capability in his past presidentship, where I can really congratulate Rishikesh for his successful and very innovative proxy presidentship, where we know that Rishikesh, you have really brought badlav not only in our thoughts, but also in our work process, as well as in the technology for women health. We really appreciate that we have a leader, and we will continue to have your services for the Foxy. As I always say, that though Narendra Malhotra is not president today, but his services can never be forgotten, because whatever he has done for Foxy is really very, very remarkable. And then, Rishikesh, I always appreciate that you are a wonderful person, a wonderful friend, as well as a person down to earth. So, as regards his orator capacities, we always know that he is a very good orator, and it's really a great thing that today we are going to have his talk on adult vaccination. We all know that these days, all these infections, like bacterial infections, we can control due to the newer antibiotics. But as regards the viral infections like papilloma virus, hepatitis B, hepatitis C, and chickenpox, these are also the infections which are leading cause of obstetric and neonatal outcome. And that is why it is very important to vaccinate to give importance to this new introductive subject, the adult vaccination. We all know that these viruses, even the chickenpox virus, can even give rise to the congenital abnormalities as well as birth defects. And that is why it is becoming very, very important. We can vaccinate for tetanus D at the time of antenatal care. But for these viral infections, we have got the best period, which is postpartum period, which provides us a window for opportunity to give vaccination for these with the disease, these viral infections, which we can prevent in next pregnancies. And so this adult vaccination about which Rishikesh will be telling us, I think no other person would be better than him to tell about adult vaccination. And I'm sure the deliberations today will go a long way in updating our knowledge. And I really wish this program a great success. And I will also like to congratulate Anju, who is the convener of the program, as well as the coordinators, Dr. Pratik Tambe, Dr. Shobha, and Dr. Sweetie, who have really worked very hard to go about all this webinar. And this I really welcome you all in the Wisdom Series 3. And today we are going to discuss infection in obstetrics and gynecology. So I will not like to waste more time, and I really welcome Rishikesh for his wonderful deliberation on adult vaccination.
This
It's a
thing.
pleasure to invite Dr. Rishikesh to speak on adult vaccination. We know how important adult vaccination has become today. We conquered infective diseases by antibiotics, then we came to NCDs, and again these infectious diseases are come back to us like COVID, HPV, influenza, swine flus, all those have come back to us. So we need to prevent ourselves. And there is so much in adult vaccination. In fact, there are two vaccines which can prevent hepatitis prevents liver cancer, and HPV vaccine prevents cervical and cancer and papillomatosis in men. So let's hear what Dr. Rishikesh has to take us through adult vaccination. Dr. Rishikesh, all yours.
I'm just trying to share. Is it coming?
Yes, sir.
Yes, sir.
So thank you very much for Dr. Anju Soni for inviting me for uh, this seminar. And I'm experimenting with a new subject, so it's not my. Of course, it was not my specialty is IVF, as you can see that I. But I also, because I was the Foxy president, I also started getting into a lot of public health kind of system, and this is a part of the public health activity of my career, I would say, for data. Just let me just. Okay, so basically, as you know that I have been, can you see this? You can see this slide, na, madam?
Yes, yes.
Yeah.
Yes, sir.
I've been presently, I'm the trustee of the FIGO for the Asia Oceania region, and I'm the professor of reproductive medicine at DY Patil. And we, as a director of Bloom IVF Group, we run 6 centers and operate 5 other centers. And I've been in the teaching line for a lot of time. I've been MD, DNB teacher as well. And for me at present, my latest thing is the passion to do more of public health. So if you look at what Louis Pasteur said, whenever meditating over a disease, I never think of finding a remedy for it, but instead a means of preventing it. And if you look at immunology and vaccination, there are 2 types of immunity you have. One is what is known as active immunization, and that in that we use the live attenuated infectious agent or inactivated toxin or antigen obtained by genetic recombination, and that's called a vaccine. Or you have the passive immunization where you give temporary immunity, which can be obtained by the administration of immunoglobulins or antitoxins. So there is definitely a benefit of vaccination for adolescents and women, and that far outweighs the potential risk of infection. Inactivated vaccines are safe during pregnancy, and live vaccines should be avoided during pregnancy. Certain vaccines are routinely recommended for all infants and children in India, and we all know that we have the BCG, diphtheria, pertussis, tetanus, the DPT, the oral polio vaccine, the HBV, varicella, measles, mumps, rubella. Sometimes you can give additional vaccine like encephalitis, parvovirus, meningococcal influenza, etc. And in adults, we also have vaccine like chickenpox. The new vaccines have been developed for dengue, typhoid, herpes zoster, influenza, HPV, etc. So who should vaccinate? First question is, of course, we know that the vaccination is the purview of the pediatrician, and all our children have been vaccinated by the pediatrician. They stay with them for nearly 10, 12 years before they start. Then, of course, there's a transition zone. We get confused when they become around 13, 14. We don't know whether if they have a fever, we should take them to the pediatrician or we should take them to the physician. But that's the transition zone. So, but in general, it is considered the purview of the pediatrician vaccination and the childhood and physicians in the adult context. And gynecologists can administer vaccines to adolescent girls. So adolescent girl is one gray zone area where the pediatricians and the gynecologists both can vaccinate those girls. And Of course, in adult women, there is this always this question: who should immunize these adolescent girls between 11 to 19 years? And what I felt is that if you look at the opportunities of vaccinations, we have the prenatal vaccination before becoming, then we have the pregnancy-related vaccination, then postnatal vaccination. There, the OBGYN or physician can be the main vaccinator. Then the neonatal vaccination, when the child is born, the pediatrician obviously is the mainstay in the childhood vaccination, pediatrician again. And adolescent is the one where there is a merger between the pediatrician, they can, or we can, or the physician can do the vaccination. And then, of course, when the women reach the adulthood, the non-pregnant women can be just, young non-pregnant women. Again, the gynecologist or the physician can vaccinate them, or after the pregnancies are over, the later on in life, again, the gynecologist or physician can vaccinate them. So vaccination has achieved a lot. COVID vaccination is an amazing experience for India. Smallpox vaccination we eradicated smallpox in 1978. India is the latest country to successfully stop transmission of polio. And infant childhood immunization is one of the top public health priorities and success stories of India in the 20th century. And the prevalence of diphtheria, pertussis, tetanus, measles, mumps, rubella, polio, all have reduced because of our very aggressive vaccination program, and thanks mainly to of course, our pediatrician colleagues. So why women should be vaccinated? Vaccination before and during pregnancy protects women from serious infections. It helps them to improve the women's health in general, and it is important preventable measure which should be adopted nationally. And so we have a lot of vaccine that you can see here. There's a whole, this is a WHO Global Vaccine Action Plan, which is there in 2012. Of course, to that we can add COVID as well. So there are a lot of vaccines that are available in the adult period. So if you look at the adolescent period, it needs special focus in India. WHO has defined adolescence as the second decade of life between the ages of 10 to 19 years old. And India is the highest adolescent population globally, exceeding 200 million. China follows with around 200 million adolescents. And the sheer magnitude poses a significant challenge to all of us, especially approximately 12% are aged between the age of 10 and 14, and nearly 10% are between the ages of 15 and 19. So we have a huge amount of young population, and we have to be responsible, and the pediatricians. So it's as I told you, a gray zone area as to who will take the responsibility. But now more and more teenagers are coming to the gynecologists rather than the pediatricians. I don't know. We'll have to do a study, Dr. Sharma and Dr. Narendra, Dr. Soni, as to where they really would like to go or prefer to go. So, but if you look at the vaccination in this particular group, Tdap or TD should be preferred over TD at the age of 10 years, followed by repeated TD every 10 years. Only when adolescent is immunized early with 3 doses of DPT. Then we have the MMR, hepatitis B, hepatitis A, typhoid, and varicella. So both boys and girls should be given it. And these are the two important vaccines as far as we are concerned. The rubella, which should be given 1 dose to girls at 12 to 13 years of age, if MMR or rubella is not given earlier. But in our practice, just before they come to us, we should again give them the rubella vaccine. Of course, if you have got the facilities, you can do the testing for rubella antibody, and if it is negative, you can give the vaccine. But if you don't have the facility, you can give a vaccine, whether she is immunized or not, it doesn't really matter. And the HPV vaccine is very important, only for girls at the age of 10 to 12 years with 3 doses scheduled, either 012 or 016, depending on the vaccine that is used. So vaccines of the teenage girl, you normally would do a catch-up vaccination for hepatitis B, tetanus, diphtheria, then acellular pertussis, typhoid, influenza, rubella, HPV, and the medical history prior affliction with this disease should be elicited, and previous adverse effects of immunization, especially allergies, should be noted. So if you look at the recommendation, MMR, hepatitis B, hepatitis A, HPV, tetanus, diphtheria, influenza, varicella, catch-up vaccination is recommended from 11 years onwards for the adolescents. And typhoid and cholera vaccination can be given. And as I told you, rubella and HPV should be given as an important vaccines for the adolescent. So especially HPV is very important because we know that the HPV vaccination will prevent the cervical deaths. We know now that if we give them HPV vaccination, we will be able to prevent the 72,000 deaths that occur annually because of cervical cancer in our country. So ideally, all women should be up to date with their vaccination. So now coming to the next group. So one was the adolescent group. The second group is just before the pregnancy. So all of the women should be up to date with their vaccination before they become pregnant. And it is known that approximately 50% of all these pregnancies are unplanned. So it is important to keep women of reproductive age current with immunizations, regardless of whether they are actively trying to conceive or not. So, but of course, that's more of a preventive. In our country, it may not be that easy to do it. So preconception immunization is a very important area. So one is the adolescent teenage, then they'll grow up and they'll then start coming to us. Now a lot of people, a lot of young women, they have started going to the gynecologist, and when they come to your clinics, you would also start targeting them for preconception immunization. So it can prevent several infections with serious consequences for the mother or fetus. Susceptible women of childbearing age may become pregnant, so you need to counsel them. Many vaccines are contraindicated in pregnancy, so we need to give them before. Preconception vaccination will ensure immunity against these diseases. Non-immune pregnant women can adversely affect pregnancy outcome, and pregnancy should be avoided at least 28 days after the vaccination if possible. And there are routine prenatal vaccination like tetanus toxoid, TD, Tdap, influenza, hepatitis B, hepatitis A, and in case there is a COVID pandemic, you can also give COVID-19. And so, just before I go on to the pregnancy, I would like to tell you about the rubella vaccine and the FOXI recommendation about rubella vaccine in adolescent girls. As history of rubella infection is difficult to elicit, it is better to give the vaccine to everyone. So it's very important to prevent congenital rubella syndrome, to give vaccine to everyone. So in our group, for example, when they come for IVF and all, we regularly, when we do the first testing, we test for antibodies. And if they are negative, then we would vaccinate. But in case you don't have facilities for testing, you can immunize them. And after waiting for a few months, then you can start your treatment. So then coming to the vaccination during pregnancy. So immunization in pregnancy is simple, effective, easy way to protect mother.
Some problem in connection only with me, or
Yes, ma'am. Even we cannot hear Dr. Pai.
okay, okay. I thought there is some problem with me.
I think some problem with his network.
Yes, ma'am.
Yes.
Dr. Pai has been out.
Yeah, I think he should take.
So can we just ring him up and inform him? Anju Didi, yeah.
I think there is some problem.
He says he's joining in a minute.
Okay. अंशु, मेरे इसके बाद वो है यूपीसीओजी का वेबिनार।
मैडम,
मेरा इसके बाद ना 7:15 पे मेरे हिसाब से यूपीसीओजी का वेबिनार है, तो क्या मैं थोड़ा पहले निकल सकती हूँ?
I think Narendra sir will be able to then
End up.
conclude, and Dr. Lakshmi is also there.
हाँ,
जी,
बिकॉज
जी.
थोड़ा सा उनका जो है 4:45 से है, दैट मीन्स तो
जी
मैं
मैडम.
मेरे हिसाब से 7:30 7:15 है।
जी, जी, जी.
क्योंकि तुम्हारा टाइम से 4:30 तो हो गया ना?
सर
आ
आप,
गया?
हाँ आप आ गए, आप हॉटस्पॉट से ज्वाइन कर लीजिए.
हॉटस्पॉट से ज्वाइन किया है अभी.
जी, जी, जी.
ओके
You can
ओके,
share
जस्ट
your screen.
या आई एम डूइंग दैट ओनली. वेट.
Sorry, I will not be able to.
अरे यार, दिख रहा है?
जी सर.
Yeah, so coming back to the topic, sorry about the disconnection. Uh, So fetal immunoglobulin concentration is much lower than maternal concentration in the first half of pregnancy. In fetus, antibodies increase to 50% of maternal levels at 28 to 32 weeks of gestation and equals maternal levels by 36 weeks and often exceeds maternal levels at term. So once we vaccinate, by the time they are delivered, the babies have got enough antibodies in their body to prevent any infections from occurring. So if you look at the vaccination schedule during the preconception and pregnancy, if you look at the vaccines, one is that hepatitis B doses are 3, 0, 1, and 6 months. That is before at the prenatal preconception, avoid conception for at least 4 weeks. So all these are for MMR and varicella. You try to avoid conception. So hepatitis B, varicella, that is 2 doses at 4 to 8 weeks. MMR is 2 doses at 4 to 8 weeks. HPV is the 3 doses or uh, which is 0, 1 for and the 0, 1 and 6 months. And influenza is 1 dose every year. Then during pregnancy, you can give TT or TD 2 doses, 1 dose early in pregnancy and second dose 4 weeks after the first dose. TDAP in the third trimester. Influenza can be given 1 at any stage of gestation, and during lactation, all vaccines except typhoid and yellow fever can be given as catch-up immunization. So another thing about tetanus, diphtheria, pertussis, and influenza, the FOXI recommendation is that 2 doses of tetanus toxin injection at least 28 days apart are to be given to all pregnant women commencing from second trimester. If the subsequent pregnancy occurs within 5 years, only 1 booster is given. In contrast to developed nations where tetanus is rare, it remains endemic in the developing countries, and the incidence often increases following natural disasters. In 2012, there were only 2,404 cases of tetanus reported by the WHO. So the tetanus incidence is going down. Coming to the influenza, so influenza vaccination is recommended for mothers from 26 weeks onward. In case of pandemic, the influenza vaccine can be given earlier to protect the mother. Both influenza A and B viruses are important as respiratory pathogens, and influenza occurs all over the world with annual global attack rate of about 5 to 10% in adults and 20 to 30% in children. Most of the infections globally are caused by H1N1 or H3N2 and influenza B virus. And every year, I also take the vaccine now every year. We should all take the vaccine. I'm telling you, this year when I took the vaccine, I've had touch wood not major any influenza attacks. So I think it is very important, and it also helps the baby also. It decreases the proportion of preterm births, low birth weight babies, small for gestational age babies, and transplacental transfer of antibodies to fetus provides some protection and decreased lab confirmed influenza in neonates. Women who have not got the vaccination can take the booster, single dose can be given, and other, as I told you, other vaccinations can also be given. What about adult and elderly women? So you have the HPV vaccination, tetanus, diphtheria, and influenza for women of all ages. Tetanus booster dose to be given once every 10 years throughout the life. No booster dose is necessary in case of an injury or surgery within 5 years of vaccination. TD can also be given throughout life in place of tetanus toxoid. Influenza, as I told you, influenza vaccination we should all take annually. All doctors, all gynecologists should take it annually, because the strain keeps on changing. So every year they have a different strain, because the strains keep on varying every year. And the live attenuated vaccine is recommended up to 49 years of age, and after that you can keep on taking it also. Unvaccinated adults of age 65 and older can also be vaccinated by Tdap. Coming to another very important vaccine for all of us, because we are all becoming older, and I didn't want to actually go too much into it, but the herpes zoster vaccine that has come, the Shingrix vaccine, is one, because 1 in 3 people develop shingles in their lifetime, and especially many of us are pre-diabetics and diabetics. The incidence of herpes zoster in diabetics is very high, so we must be careful. And the more than northern 90 vaccine, Shingrix vaccine, and 2 doses are to be given. And I think we all should take our doses. Can you hear me? Hello, can you hear me well?
Yes, sir. Yes, sir.
Okay, so coming back again, this is a beautiful, I wanted you to go with me through this again, the vaccination. So if you look at it, they have divided it on the vertical between 1920 to 26 years, 27 to 49, 50 to 59, 60 to 64, and more than 65 years. And tetanus, diphtheria, and pertussis, Tdap can be given till from 19 to 64 years. Okay, substitute one-time dose of Tdap with TD, then booster with TD every 10 years. After 65, TD booster can be given every 10 years. HPV, as we have already known, 3 doses can be given between 19 and 26 years. Varicella, you can give 2 doses anytime from 19 to 65 years. Then zoster, you can give after 60. So you don't have to take the Shingrix vaccine before 60 years of age, though many people are recommending it after 50 also. But like all of us 60 plus people should take the Shingrix vaccine. That is the herpes zoster vaccine. Recently, one of my known people had the herpes, and it was really painful. And for 2 months, he could not sit also properly. Then measles, mumps, rubella, 1 or 2 doses between 19 to 49 years. Influenza, 1 dose annually can be taken anytime. And pneumococcal vaccine after 65. Pneumococcal, many of us will die of pneumonia. So pneumococcal vaccine is very important to be taken after 65 years of age. This is again another sheet of the, but I will not go through it generally. So another thing is that what are we going to do? How are we going to implement it in our consulting room? So very important, because I feel that when I was Foxy president, I wanted that all of us should start the adult vaccination program, just like the pediatricians have the adult vaccination program. I mean, the pediatric vaccination program, and they have made it a, not only it is a good social service, the children are being protected, but it is also a steady, good income for the pediatric community. The vaccination program, it is a good additional income flow for them. And I feel we should also, that not only will help society by vaccinating all of them, but it will also be a new income stream for our Foxy members. So before the visit, suppose we start an adult vaccination center in our clinic, what should we do? So this is what the pediatricians do. They do. So before the visit, you can have pre-registration, which may minimize time in the waiting room where anxiety can mount. we can establish expectations if possible. Let patient know they will be offered any needed vaccination, that you will work with them to make the experience comfortable. Set up the vaccination room area so it's comfortable and private. Keep needles out of sight until necessary. Consider topical analgesia. Especially in children, they give topical anesthesia. You can have a cream anesthesia so that the injection is not painful. This may help with the pain, but many of the adults also, they are very scared of injection. So, but needs to be applied to the vaccination site 30 to 60 minutes ahead of time. With guidance, some patients may accomplish this before arriving also. Then during the visit, screen for vaccinated related anxiety. You can check the list for contraindications of vaccine. You can go to immunize.org and find out whether there is any contraindication for a particular vaccine. Invite patients to ask questions about vaccination process so they feel prepared. Watch your words also. Use words that help the patient cope during vaccination. Using fear-provoking words such as shot, sting, or false assurances that it won't hurt a bit can increase distress and pain. Ask each patient what helped them feel comfortable. Make suggestions if needed. Slow, deep breaths can be calming. A lot of people like to be distracted, and they can be encouraged to chat or use their mobile devices. Posters can serve as distractions to offer pain management options if feasible. Asking patients how they prefer to manage their anxiety is very important. After the visit, use of pain-induced reducing medicines such as ibuprofen or acetaminophen can be used. But you don't like to use them before vaccination because it may diminish the immune system response to vaccination. They may be used to treat pain or fever after vaccination. And use of non-pharmacological pain management options such as pulling the injection site, using injection techniques that diminish the pain experience, placing a vibrating case with optional ice pack, placing a plastic device with several short blunt contact points, etc., can be utilized. So, for as far as the Foxy presidency was concerned, I also did Raksha program for adult vaccination with Zydus, and lot of our like Ritu, our chairman, was very active in that. And we have done a lot of programs all over the country. Then we also have with our another chairman, Priya, we have also done the HPV vaccination campaign with American Cancer Society and the Cancer Foundation of India. So we are training 10,000 gynecologists. They have given us a grant to train 10,000 gynecologists in how to do HPV vaccination. And now with the MSG for mothers, we are starting the Kavach vaccination centers. We have already launched them and they are in the process of starting. So you can apply and they will help you to start the Kavach center in your own private clinic. So I would like to thank you all for a patient hearing. I know it's a short but it's a short overview. I didn't want to really go into the details of it. I just wanted to give you a general overview about the topic.
Fantastic coverage, Dr. Rishikesh, of all adult vaccination. It is so important for the doctors to understand and prescribe and ask the patients to get vaccinated, because we can save so many lives just by getting HPV, I mean cancer cervix especially, and hepatitis, simple, influenza, rubella, all these vaccinated. Now even for chicken pox and brain encephalitis, all that should be given. Adult vaccination, I feel, should be promoted a lot, and everyone should prescribe. Patient doesn't want to take it, it's fine. But at least your responsibility is that you put a paper whenever in your OPD, just clip it that in adulthood, these are the vaccination you should take. That is my take on this. And we did start the vaccination schedule in adult in 2008 during my presidentship, and then Dr. Girija and all took it forward, and now you have taken it right to the grassroots. Thank you very much for the lovely deliberation.
I think that now we have to see, encourage our president, Dr. Tang, she's very progressive, and they has to take it forward. So I think that it has to be a movement, basically. And there's a lot of potential, and I look at it from both angles, that we must do it as a commercial angle also and as a social work angle also.
True. Rishikesh, these days it's really very, very much needed in the society, because due to these various viral infections, many times we have to face, I can say that we are also so much disturbed and we are also so much disappointed that we did not vaccinate the lady, and this has become the problem like this. And you have really narrated everything so well that Narendra also has mentioned that we have to have vaccination. And actually, this was not adult vaccination, was not given so much of importance till now, which is the need of the day. And all the things we can prevent, we can vaccinate during antenatal period, we can vaccinate during postpartum period. And what are the vaccinations which are available? This was a very, very useful knowledge which you gave us today. And thank you very much. It was a wonderful oration, I would like to say. And it was a real pleasure for me to be as a chairperson in this webinar. Thank you very much, Anju. Now I would like to leave as I have to be in that UPCOG seminar. But really, it was so nice that I could give comments on the wonderful oration of Rishikesh. Thank you very much, Rishikesh. I'm
Thank
sure
you, madam.
everyone must have been greatly benefited by this oration. Thank you, Anju.
Dr. Lakshmi, you want to add something?
No, already big shots. Dr. Narendra Malhotra and Dr. Usha Sharma madam has given comments, and Dr. Pai has really covered all the topics and all the aspects. But Dr. Pai, at the Foxy level, we should follow up with the government that as of now, we really don't have adult vaccination program in the government thing. All what we are doing is like Foxy, IAP. I mean, we are doing association wise or single doctors. But government also should come out with a adult vaccination program, and they should have it so that it becomes a uniform thing. That is the only thing I want to add. And I know Dr. Pai has done a lot of work. Dr. Tank will do the follow-up. Yes.
Lakshmi, we have already had a group meeting, the API, the Foxy, IIP, all of us have got together, and there's a new document that is about to be released. It is called Harmonized Adult Vaccination Document, which has been jointly done by all the associations. And that document will, see, it takes time. Once we have an advocacy document, then it has to ultimately reach the big boss, that is our Prime Minister, in the PMO's office. And then that document has to be pushed by Niti Aayog, and then it can become through the NMC, it can be as a government program get implemented. So they are totally focused on the children at present. But I'm sure now they have procured I've heard that they are procuring 7 crore doses for our girls for the HPV vaccination. So once that is done, it will become. But I feel that our society is, I would say, binary society. Basically, we have got 100, 200 million well-off people and 1.2 billion not so well-off people. So the government is taking care of the 1.2 billion, but the problem is that the 200 million well-off people are not taken care properly. And, Foxy has a lot of role to play in those 200 million, which is quite a lot. It is the population of Indonesia, 200 million. So it's quite a lot of population, and that is where we should concentrate to start with. So once we have we can do and demonstrate it in our 200 million people, then automatically the government is getting their grants and all. But this, what happens in this, the overlap, the middle people, they are left hanging. Because it's, see, like, to give you an example, when I wanted to do my thyroid surgery, I was told that there was a very good doctor in the general hospital, where they said only one lateral cut, he removed the entire thyroid to the lateral cut. But he was in a general hospital. And then I ultimately said, I can't go and do the surgery in the general hospital. Not that. So the greatest doctor was there, but I didn't want to go there. So this is the big problem. So a lot of people want to access the government institute, but they don't want to go there. They don't want to go to the toilet. It's very difficult for them to share the toilets or share the ward with other people. So it's just a problem. So that is the big problem. So there are the societies divided into two parts in our country, and there's no way we can overlap that part. And I feel that ultimately our government has to also take care of those 200 million people. whom
Yeah.
they are saying अच्छा they are private में वो देख लेंगे, ऐसा नहीं है. They also are paying other taxes, and just like we have the gas cylinder scheme, because they say
Yes.
na, you are getting gas cylinder but you leave it if you don't want it. Similarly, the Ayushman Bharat should be for everyone, all the 1.4 billion. Then let me leave the Ayushman Bharat, na. It's my right. Let me leave it. I'll give it away. But I should be given that access to that right. It's my right as a citizen of the country to have access to that free, that whatever I may do it or not. And the second thing, I also feel that because this is in the last government meeting before I finished my Foxy president in Delhi, I told them also that there is a problem here. On one side, we have huge amount of waiting lists in the general hospitals, and the other side, the private hospitals are all vacant. We have huge amount of maybe some of the private hospitals are very famous and popular, and they are full all the time. But my hospital, for example, my IVF center, we are underutilized by 80%. I only do 20% of the capacity which I could do in my private. So why can't they send the patient? We'll do them at that cost. So see, these are the issues we as our association have to put forward to the PMO. The PMO decides the country's future in our country. So PMO has to understand that, we do this, why can't we allot? We'll do IVF for 60,000 rupees in private also. We can't do it.
Just can't do it. No, it was wonderful, and I'm so happy that Foxy is paying attention and all. But all adults who are here, please, you should know that we need vaccinations. Be in touch with your regular physician. They all are following in their private practice the adult vaccination thing for Indian population. So be in touch with them. Yes, Malhotra sir, आपको कुछ बोलना है? Because we take flu vaccine every year. Yes, sir.
Glaxo company had a
Yeah.
scheme for gynecologists also.
That is
they
what
will
I am
give
saying.
discount
It should know.
for Shingrix vaccine. So
And
all
now-
gynec more than 60 should take the Shingrix vaccine.
And Shingrix, yes, I
Very
was coming
important.
to that. Shingrix also and flu vaccine, so we should take every year. And for Indian population, it should be between July to September month, because that is the thing.
Narendra, have you taken the Shingrix vaccine?
No, we are planning. Narendra
Yes,
sir,
I have
आपने लिया?
taken.
Huh?
What is your
I have taken
experience? What
shingles
is your
because my
experience?
sister got it and I saw her suffering. I took it last year.
Okay, so because I was a bit apprehensive also, what is your personal experience of taking the Shingrix vaccine? Is there any issue? Was there any issue? Pain?
No,
This thing?
just 24 hours local pain and slight malaise. That's it.
Because we are also planning to take.
I've taken all possible adult vaccines. I have taken including encephalitis, chicken pox, everything. Though I've got chicken pox, but you still have to take them. Because
Okay,
you
okay,
get these diseases, then at this age, 60 plus, they're going to be very, the
Yeah,
morbidity is too much.
agree. I think I should now, after this talk, Anju, I have to go and take the Shingrix vaccine.
Yes. So it should start from us. Yes, Anju, you can
Yeah.
concluding remarks.
So,
Yeah.
so
Okay.
thank you, Dr. Pai, Dr. Narendra Malhotra sir, Dr. Usha, and Dr. Lakshmi, and my coordinators, Dr. Shubha and Dr. Sweetie. I thank all the delegates who have joined. We'll be sharing the YouTube link who have not been able to see this program because of the paucity of time. And I would like all of you to join us on next Wednesday, where Dr. Narendra Malhotra is going to give his insight on very, very important topic, which I am not disclosing now. I'll be sharing very soon. So looking forward to meet all of you next Wednesday, 4 p.m.
See you all. Bye.
See you all.
Bye.
Thank you, sir.
Bye.
Bye.
Thank you, sir.
Thank you.
Bye.
Bye.
Okay, ma'am.